Thank you, Honorable House Chair, Honorable Speaker, Honorable Chairperson of the NCOP, Your Excellence, the President of the Republic of South Africa, Honorable Ministers, Deputy Ministers, members. The biggest enemy of health in developing world is poverty. This is what the former Secretary General of the United Nations, Kofi Annan, said on the 17th of May 2001 to the 54th World Health Assembly. They view that good health is good for individuals, families, society, and central to economic development, is well established globally and not contested. In fact, the World Health Organization noted that, and I quote, "Better health is central to human happiness and well-being. It also makes an important contribution to economic progress as healthy populations live longer, are more productive, and save more," close quote. It is therefore not surprising that both the Millennium Development Goal and the Sustainable Development Goals include health as goals. In addition to the National Development Plan notes that the importance of creating the condition for people to develop their capabilities to the fullest, including ensuring political freedoms and cultural human rights, providing social services like education, health care, public transport, social security, and safety nets. Health is a human right which is enshrined in various global institutions such as the United Declaration of Human Rights. Article 25 of the Universal Declaration states that, and I quote, "Everyone has a right to a standard of living adequate to the health and well-being of himself and his family, including food, clothing, housing, medical care, and necessary social services, and the right to security in the event of unemployment, sickness, disability, widowhood, old age, or other lack of livelihood in circumstances beyond their control," close quote. It is clear, therefore, that human rights are central to health and the provision of health services. The poor health outcomes are not necessarily and exclusively a reflection of the health system alone. There is a vast range of generic, socio-economic, and behavioral factors, including population health status, and of such factors that drive poor health outcomes are present in South Africa. These includes, but not limited to, housing access to clean water and sanitation, clean environment, poor diets, among others. These social determinants of health create high level of need for healthcare services, imposing heavy burdens to the country's health professions. Our own constitutional mandate in relation to healthcare is properly articulated in Section 27 of the Constitution, which provides that, and I quote, "Everyone has the right to have access to healthcare services, including reproductive health care." It further stipulates that the state must take reasonable legislative and other measures with its available resources to progressively realize these rights, and no one may be refused emergent medical treatment, close quote. There is general agreement that this constitutional requirement that there are universal access to health services is appropriate. There is, however, differences, especially in some in the House, in the current interpretation of the constitutional requirement of universal access. That is in terms of the model of how should it be designed to achieve universal health care. There are those who are for a liberal model, which is aimed at perpetuating the current status quo. The World Health Organization postulates that the goal of universal health care services is improving equality in the use of medical health services, improving services quality, and improving financial protection. The affordability of health care services is a key factor in assessing the extent to which a society can be said to have universally to health care services. Despite the significant burden of disease from HIV, which is coupled with a very high rate of TB, of which, according to the World Health Organization, South Africa has the third highest incidence of TB in the world after India and China. We have made progress in the past few years. We must, however, admit that we still face with many challenges in this regard. And therefore, we still need more to be done in order to ensure that we build a resilient healthcare services. The 90-90-90 strategy by 2020 will go a long way in eliminating the scourge of HIV. The World Health Organization lists 6 building blocks of health system. These are governance and leadership, service delivery, health workforce, health information system, access to essential medicine, and financing. Without these ingredients, we cannot have a resilient health system. In the past few years, the world has come to the realization that these building blocks must be considered within the context of universal health coverage. That is the provision of health services to everyone based on need, not on ability to pay. Access, therefore, refers to people's ability to obtain and appropriately use quality health services, since having access to health care is a right for everybody. The concept of universal health coverage takes the form of a universal health insurance in our country. The NHI will make health system resilient and fair. There is sufficient consensus that the NHI should seek to achieve various principles, of which key amongst them includes right to access health care, social security, equity, treating health care as a public goods, affordability, etc. Our current health system is decidedly unfair. Massive inequity exists between the public and the public health sector, where less than 20% of the private health sector has access to approximately half of the country's GDP spent on health. The bulk of the expenditure is due to hospital costs and medical aid costs. The cost of health care is escalating at an unacceptable level because of the existence of a two-tier health care system that is not integrated to benefit the whole population, but is designed in a manner that enables to benefit the elite few. The public health, on the other hand, with the same amount of money, has to provide health services to the remaining more than 80% of the population, relies on the public sector. This level of inequity is naturally wrong, unacceptable, and must be abolished as a matter of extreme urgency. The fiscal federalism in the allocation of funding that has been introduced since the establishment of the new democratic dispensation has exacerbated the realization of a comprehensive and integrated system as envisaged in the white paper on the transformation of the healthcare system. The process as outlined by the President of establishing NHI is a means to address the financial allocation of resources across levels of government, correcting management problem, reducing disparities in access to quality health care, and focusing on the health outcomes. It is in this context that as members of the African National Congress, we highly welcome and support the process that the President has clarified to this House of the introduction of the universal healthcare system through the introduction of the national health insurance legislation, which will soon be tabled before Parliament. And we want to assure you, President, that we are ready to make sure that we process that legislation when it comes before this House and pass it so that we are able to introduce this national health care insurance to our people. The NHI white paper outlines how we intend to correct this unjust situation. All funding for health services will be pooled, including your own medical aid and mine, and distributed to both public and private providers to provide services at the same level of quality to all South Africans. The full implementation of the NHI will require that all South Africans work together with government. This means that employers, people who are currently on medical aid members, that is yourself members, organized labor, and health professionals must be prepared to pool these resources for a common good. When people are sick, they must be able to be provided that service on an equal basis. Ensure that the primary responsibility is to ensure that we provide and create a healthy nation. NHI requires the full participation of all health professionals, including those in the private sector. We must use the skills of all health professionals at all levels of care. Since the International Conference on Primary Health Care in Alma Ata in 1978, there has been global agreement of the importance of primary health care as a foundation for our health system. It is clear that for the NHI to work for everyone, we must strengthen PHC. Improving quality of care in the public sector facility remains an absolute priority of government. The Department of Health has started with a process to improve quality of services by introducing two key initiatives, of which one of them was the introduction of the Office of the Health Standard Compliance and the Ideal Clinic initiatives as part of the Operation Pakisa. As part of the OHSC development, a set of national core standards were developed against which all facilities in South Africa are currently being assessed. The Ideal Clinic initiatives provides detailed benchmark for what is regarded as a well-functioning clinic or primary health care facility. This integrated approach will ensure that our people get the best possible care where they visit primary health care facilities. It will also help us to ensure that patients do not bypass clinics and seek care in hospitals for primary health care. At this point in time, 1,270 clinics have all the components necessary to ensure they are ideal. We must move with greater speed to ensure that the remaining clinics reach ideal clinic status as soon as possible. It is critical that our people experience ideal clinics as a whole. This will be proof that our clinics are providing the best quality care. A good primary health care system does not only depend on clinics. We must all focus on prevention of diseases and promotion of health. Our country is confronted with a rapidly growing rate of non-communicable diseases, resulting largely from lifestyle changes that include obesity. We know that we are the most obese nation amongst the world. Smoking, abuse of alcohol consumption, unhealthy diet, and lack of exercise. This results towards a range of diseases such as diabetic, hypertension, cancer, cardiovascular diseases. This leads to premature deaths and high absenteeism, in which in turn contributes to low work productivity at work and therefore slow economic growth. Tackling these risk factors is a whole of government and whole of society's responsibility. To avoid the NCD tsunami in our country, we must take a very robust approach on how to deal with these risk factors. This includes engaging the food industry to ensure that they produce healthy food, which is affordable, less sugar, less salt, regulated advertising of tobacco and alcohol. Cancer has become the latest opportunistic disease that kills people which are infected with HIV. As announced by President Ramaphosa, the department with its partners will launch a national cancer campaign this year. The campaign must focus on the risk factors for the various cancers to increase awareness on these risk factors. The campaign must also focus on the importance of self-examination where possible, as well as early detection and treatment. Critically, our people must also have information to help them to prevent cancer in the first place. The general risk factors that apply to NCDs also apply to cancer. Therefore, this requires government departments to work synergically so that we package the services that can be provided to every South African. However, government alone will not be able to ensure a healthy environment. We also need the private sector. The food and beverage industry, for example, must ensure that healthy and nutritious food are provided to the market, and that unhealthy foods, beverages are not made available in the market. If they do not take responsibility, government will have to strengthen its regulation. Despite all the measures that we can take to prevent diseases, we must know that at the end of the day, people do get sick. When this happens, we must be able to provide patients with the best possible clinical care in our hospitals. This means ensuring that we have skilled health professionals. Our procurement system must be improved. Our financial management system must also make sure that it's improved so that we're able to make sure that we're able to pay service providers within 30 days after they've been provided the services. We must improve our own infrastructure. One of the challenges of providing healthcare services is the escalating cost and litigations. The prices of medicine, diagnostic technologies, as well as the remuneration of health workers are all increasing above general inflation. We have to put measures in place to contain costs. This is what we intend to do by the introduction of the NHI. To inspire us to work hard and collectively to implement the NHI, to ensure that we have a resilient health system based on human rights principles. Let me end the quote by quoting one of the quotations from the icon, the former President Madiba, when he said, "Health cannot be a question of income. It is a fundamental human right." Close quote. I thank you.
Thank you, Honourable Member. The next